The Transitions program is all about house calls.
Okay, now this was our wedding picture here, and that was on September 9 of 1950.
Today, Transitions staff are visiting Louis and Lois Alfeld in their San Carlos townhouse. Louis has dementia. His wife Lois takes care of him. Nurse Wyatt Knapp wants to see how well Louis is tracking things.
Do you know where we are today?
Yeah, right here.
Perfect. I like that answer. That is a perfectly acceptable answer.
Knapp talks with Lois about dementia and what she can expect.
With dementia, we wax and wane, right? So we have good days, we have bad days. But overall, as long as he's staying stable, and I think he has probably more good days than bad days in his case.
Oh, yes.
Lois says she has noticed some changes.
His way of trying to explain to me what he needs, what he wants, is becoming, I think, more difficult.
And that can cause for him more anxiety and more frustration. Right?
Oh, yes.
So as those communication things become more difficult, that's when patients often start displaying more signs of anxiousness or even agitation.
Knapp goes on to say that there will come a point when Louis's decline will happen more rapidly.
That's where I feel like I'm waiting for the next shoe to drop.
But that's why we're here, right? Because when that shoe drops, we're your safety net.
That's why I'm so glad I've got you in the background, if not right here, at least in the background.
The Transitions program was launched in 2007.
Once they start referring patients to this particular program, they get it.
Dr. Daniel Hofer came up with the idea after years of observing a reoccurring problem with many of his elderly patients. Those who had heart failure, dementia, and other serious health issues would reach a point when they'd frequently go in and out of the hospital.
There's at least 20 hospital side effects.
Hospital care can be disruptive, expensive, and dangerous. Studies show about 1/3 of elderly patients leave the hospital in worse shape than when they arrived.
They said, well, let's create a proactive program.
Hofer thought there has to be a better way.
And in the proactive program, you say, I know where you are in the natural progression of your illness. And you're at the point where you're going to start to use the hospital as a tool to manage exacerbations of a predictable medical condition. We've eliminated that.
Because the changes that you're going to see in your husband or your loved one, they're going to occur.
Transitions provides proactive care and patient education, all in a patient's home.
This is one of the fundamental constructs of our program. Stop bringing patients to care and start bringing care to patients.
Talk about Advanced Healthcare Directive.
Sharp Hospice Care Vice President Susie Johnson helped Hofer start Transitions.
People live a long time with chronic illness, a long time.
She says the program addresses a long-neglected group, people who are in the pre-hospice phase of life.
We have not really been well prepared to think about how we care for the aging over a period of time. This program helps manage people over a period of time.
Johnson and Hofer recently had a study on transitions published in the Journal of the American Geriatric Society. It showed on average, transitions saved just under $20,000 per patient at the end of life, compared to patients who went the hospitalization route.
Sometimes he shocks me with the knowledge that he does have.
Lois Alfeld knows there will come a day when she can no longer take care of her husband at home. Nonetheless, she tries to stay positive and even gets a few laughs in here and there. Lois says her husband can no longer recognize their children.
I tell him that our oldest son is named after him, but he's not a junior. He's Louis Alfeld.
He asks what their names are.
He will say, oh, that's the same as mine. And he's even asked me too, who's his daddy?
A study in the American Journal of Public Health puts things in perspective. It estimates in 2011, $280 billion was spent on people in their last year of life.
We always knew we had to work together.
Kenny Goldberg, KPBS News.